I'll resume it now.
Okay, very good. Thank you. Hello, everyone. Again, my name is Chris Marchioni. I'm the Executive Director at Person-Centered Care Services. Thank you for taking the time out of your busy schedules to join us. Our partners at the New York City Department of Health and Mental Health are on the call. And along with, most of you know, Dr. Ginny Mantello. Dr. Mantello is the Director of Health and Wellness at the Office of the Staten Island Borough President. But in addition to that, Dr. Mantello is a practicing neuroradiologist, and public health is her passion. She's been in her current role for 7.5 years, and a lot of her work pre-COVID was centered on upstream prevention and early intervention, working with children and vulnerable subsets of the community. She did a lot of work with schools and focused on obesity, asthma, and behavioral health. And right now she's the medical director and co-chair of the medical arm of the Staten Island COAD, Community Organizations Active in Disaster. We've been very active over this past year and a half between getting PPE, personal protective equipment, masks, gowns, gloves, you name it. And of course, with the vaccine and getting the vaccine rolled out, and Dr. Mantello has been so powerful and so engaging and reaching out to the community and educating us and giving us the most up-to-date information there is. And you'll be hearing that tonight. Dr. Mantello also works with the New York City Department of Health and Mental Health. She works with the New York State Department of Health, as well as many national organizations like the American Heart Association, the American Lung Association, the American Cancer Society, and there's just too many to list. So now I am going to turn it over to Dr. Mantello, and she's going to be updating all of us with the most recent news and information regarding COVID-19. Dr. Mantello.
Thank you so much, Chris, and good afternoon or good evening, whichever way you like to look at it, everyone. So happy and pleased to be here this evening. And before I go on to some recent updates and talking about the different variants and the different things that are out there, urgent information, I would like to first thank everybody for joining this very important conversation. I want to thank Chris and all of the group home leaders for getting behind this and really making this a priority. I think that the bottom line is we want everybody to know why it's important to get vaccinated, why it's important to keep yourself, your loved ones, your family, and the people you take care of safe, why and how. And so thank you all for joining this conversation. I want to particularly thank our colleagues from the health department. We partner on many initiatives, as Chris mentioned, and this is just one of them. We have a number of people from the health department team on our call today, and I'm going to start off with introducing Chelsea Cipriano, who I talk to practically on 3 times a week. Chelsea is the executive director for the intergovernmental initiatives, and she regularly updates all of the elected officials on what's going on citywide, statewide, and nationally. And she's going to give us a high-level overview. We also have Jean and Beth Sullivan, and I'll be introducing the rest of the team as well. Chelsea, did you want to start us off before I introduce the rest, or did we want to?
Yeah, I am absolutely happy to do that. Thank you so much, Dr. Mantello, and for your partnership throughout all of this. It has been a crazy year and a half, as everyone on this call knows. I am going to do a quick situational overview, but Jean or Shayla from my team, I'm not sure who is controlling slides, but I am happy to use slides or just do it ad hoc, whatever works for everybody. I know that.
Yes, yeah. I had a slide deck prepared, and that had a lot of the similar information. So okay. I have a bunch of slides, but if you want
You
to
want
do
me to
ad
just
hoc,
to-
and then I can
Yeah.
skip over.
Yeah.
I can skip
Totally.
over some of those that you already covered.
Yeah,
And Chelsea, I
can
just made you
definitely-
co-host if you want to share any slides
Thank you.
as an option.
The power. No, I will do, yeah, I'll share my screen if that's okay with everybody. I'll do it really quickly, Ginny, if that's
Sure.
okay.
Absolutely.
And then we can just skip through, other, if there is repeats. So I will just start really quickly with, the unfortunate bad news that while we all want it not to be the case, COVID-19 obviously is still very much with us here in New York City, definitely here with us in Staten Island, and we're still losing a lot of friends and family members. And we know a lot of folks who are getting sick every day. And so there's still, I can't share my screen and talk at the same time, so I'm just gonna do it ad hoc. It's okay, Jenny, I'm sure your slides have these things. There's still, a lot of transmission happening in New York City. We are still categorized as a high transmission area by the CDC. Our citywide, we don't use percent positivity so much anymore because using it with so many people vaccinated in New York City right now makes it less of a meaningful indicator about what's actually going on. But it is 3.45%. In Staten Island, that number is 5.87%. And if you go on our website at the health department, and I'm sure some of Ginny's slides will have this, you can see a lot of really interactive maps where you can kind of hover over an area and see your zip code or see your neighborhood, and look at what's actually going on there with transmission as it compares to other places in the city. And you can see on the heat map, many parts of Staten Island are still, oh, this is perfect, thanks, are still very, very deep red. And so this is the map right on our website. You can explore it by zip code. If you want, you can go and look at it by race and ethnicity. All of that is on our site, which hopefully is helpful for folks to get an understanding of what's happening in the situation right now. So the one thing I'll talk about very quickly is the situation in light of the Delta variant. I think we all unfortunately know it. It is not just an airline. It is this very dangerous, very highly contagious strain of the virus that we know is more transmissible. We're seeing it more in kids, more in all age groups. It's about 98%, 99% of cases in New York City right now are Delta. And we have this on our site as well. It's like this very good graphic of looking at, oh, this is great, Ginny. You can see what percent of tested cases. So it's not we don't test every case, but we sequence a sample of that's representative. You can see what percent is Delta at any given point in time. And it's just been climbing up to the point we're at now, which is basically all cases are Delta. What does this mean? Basically, it means that getting vaccinated is that much more urgent right now. So really, we know that vaccines work. They work to not only prevent illness, but really take care of the biggest concerns, which is preventing hospitalization and death among New Yorkers. And this is our best tool in our toolkit of many tools and layered things like masks and distancing and all of the other precautions we take. This is our best tool to really, really defeat this thing and protect ourselves and protect one another. I think what we're seeing all over the country right now, I know some hospitals in Staten Island have felt this as well, is hospital capacity really starting to feel what it means to have more COVID cases, more Delta in particular. Anecdotally, I'm from Louisiana, and we know folks who are, because of Delta, not able to get a hospital bed for cancer treatment right now because they are full of ICU patients for COVID. And the vaccine is how we prevent that from happening here. From Louisiana, but originally from Staten Island. My family is. Anyway, so I think the key here is really helping everyone understand how and when, or now is the time, but how to get vaccine in New York City, right? So we want everyone to know by heart the website vaccinefinder.nyc.gov. That is a website that should just be on everyone's mind. If they ever have anyone ask them, where can they get a vaccine? That is our number one spot. It has pop-ups. It has pharmacies. It has, city-run sites. It has FQHCs. And you can also always call 877-VAX4NYC. I think most folks know this, but anyone over the age of 12 is able to get, or 12 and older is able to get vaccine now. And everyone 12 and older is eligible for the in-home program. So you don't even have to leave your house. You can just get a COVID vaccine, nyc.gov/home vaccine. And what we really want everyone to know is that getting a vaccine in New York City is safe. It's easy. It's free. That has never changed. And the key things about vaccines are that they're safe, effective, and life-saving, and they're recommended. Even if you've had COVID, this is really important. We hear a lot of questions about this. Should I get the vaccine even if I've had COVID? Yes, unequivocally, yes. If I have antibodies still, yes. We know that people can get COVID again. And they, of course, don't contain the virus. They don't alter your DNA. There is a lot of news out there right now about boosters versus an additional dose. Jenny, let me know if I'm going too much into your presentation. I'll stop talking. But I just want to make really clear about who should get an additional dose right now. Those are people who are moderately to severely immunocompromised. So you don't have to prove, you don't have to bring your medical paperwork or anything like that to get a third dose at sites around New York City, but you do have to attest that you do fall into one of these categories and thus are eligible, because they're only authorized right now for people who are severely or moderately immunocompromised due to a medical condition or treatment. And that's only for the Pfizer and Moderna vaccine. So it's not for J&J. That's still being studied. It came out later, so they're still doing research on J&J. That's different than the booster news that came out from the federal government a couple of weeks ago saying, I think it was a September 30th deadline or announcement about 8 months past your first shot. There is not formal official authorization for that yet. So we await the federal government authorization. Right now, just third dose for immunocompromised people. Very quickly, and then I'll stop talking. In New York City, we have over 10.7 million vaccine doses administered, which is amazing. And we're at over 65% with New York City residents with at least one dose. For adults, that's even higher. It's in the high 70s. We have all this data on our website to show where we are in terms of vaccination. It's the same heat map and other maps that you saw about transmission. You can see Staten Island stats as well. Check out your zip codes. In Staten Island, for people with at least one dose across all age groups, 61%. That's compared to 65% citywide. And for fully vaccinated, it's at 55%, just under the citywide average of 59% for fully vaccinated. So that's pretty good. And we're seeing increases week over week. Keep it up. We want to see those numbers climb even higher. And I think I'm pretty much done, Jenny. My last PSA is always about mental health. We are all very traumatized from the last year, and that I don't say that glibly. It's very real, and people need resources to take care of their mental health. So Ginny is always great at plugging NYC Well and Project Hope for coping during COVID-19. So I'm happy to drop those links in the chat. I think that's it. I'm sure I'm missing stuff, but happy to answer. Oh, key to NYC very quickly, of course, is a requirement for indoor dining, fitness, and entertainment. And then, of course, there have been additional employer mandates, as I'm sure you're all aware. But this is all part of this rollout of really trying to fight Delta the best we can.
And I do have some slides on those as well.
So I'll cover, take it all over. Okay.
I'll cover those briefly, but that's great. Thank you so much, Chelsea.
Of course.
And as I always say, I'm always amazed at how much you can cover in such a short time. So thank you again for hopping on and for sharing. I do also want to introduce the rest of the team that's going to be speaking today. Beth Nevin, who has worked for New York City Health Department for almost 30 years, first in tuberculosis control and then in the Bureau of Communicable Disease, where her focus was on influenza outbreak management in long-term care facilities. And now she's currently working with New York City nursing homes to support COVID-19 prevention and response, and she's been working with us on the Staten Island end as well. Jean Sullivan Meisner, who I have been speaking to regularly as well, co-leads the New York City Health Department COVID-19 congregate setting investigation and response unit. And she's also been at the health department for 13 years in the Bureau of TB Control as the team leader for molecular epidemiology and outbreak detection and response. So I guess she knows a lot about outbreaks, and we need to, make sure that we tap into her and keep well informed. And then last but not least, Shaila Rao, who is leading the Vaccine Education for Health Department Congregate Care Setting Investigation and Response Unit, and has also worked in numerous roles throughout the COVID-19 response and works in the Bureau of TB Control as Director of Outreach. And so I can't thank them enough for taking the time out and for spending their afternoon today to update all of us on some of the most current and up-to-date information, as well as some of the research that went on right before the vaccines were approved, and so on and so forth. But what I will do now is share just, I want to start off the conversation with talking a little bit about what's new, and also talk about, the variants. I know there's a lot of information floating out there, and I want to make sure we clarify some of it today. And part of the idea today is we want you to be able to ask questions. I know we have some personal stories that are going to be shared. And so we really hope that everybody gets, plenty of information out of this conversation. And also, hopefully you will encourage your coworkers and others to join the next session and listen to it once we have the recording. So I'm going to start off by, sort of dialing it back a little and talking to everybody about what are variants. So every virus or all viruses have the potential to mutate or change. And if you think about influenza or the flu virus, every year, the reason we need a booster shot is because the flu virus, like other viruses, likes to mutate itself and change itself so that the coverage for the last year, the vaccine that was developed, doesn't necessarily cover you for the strain that's emerging this year. So what is important to remember is that each time the virus spreads from one individual to another, it tends to change ever so slightly. And that slight change can be detected. And when we talk about sequencing these viruses or studying the genetic sequence of the virus, what we're doing is looking for that little change that's happened in the genetic sequence or the mapping. And if we had a group of 100 people in a room and the virus was spreading, we would be able to see an ever so slight change, perhaps in just one little sort of sequence in each of them. And we would know that strain is the one that has spread amongst that community, so to speak. So the mutations are much more common, and as the number of cases increase and as we spread it from person to person actively in the community, more mutations tend to happen. And that's one of the main reasons why we need to get more people vaccinated and need to stop the virus from spreading, because the more it keeps spreading, the more it's going to keep changing that, because that's just what it does. From the start of COVID, SARS-CoV-2, that we identified last March to now, we've had thousands of mutations. Only some of these take foothold and become more aggressive and sort of change enough to cause a serious impact. And in India, for example, when COVID was spreading rampantly and everybody heard about how severe it was, that's where the Delta variant emerged. So some of the variants that emerge spread more easily, and some may cause more severe disease. And that's why it's important to keep track of those that really take foothold in communities. And they obviously can lead to more cases, hospitalizations, and deaths. So, CDC classifies these by variants depending on whether they simply have a genetic marker that's associated with higher risk, or a variant of concern where there's more than just a marker, there's actual evidence to show that there is much more spread reinfection or more severe illness. And so the one Delta, for example, is a variant of concern, and some of the ones we're tracking are variants of concern. And then there are variants of high consequence, which we're not really going to go into in detail. What I want to show you here, and this is something already Chelsea already pointed out, almost every single case that we're now sequencing is Delta. And it was only a short while ago, like end of June or so, that we only had about 5 or 10% of our cases that were Delta. Now, because it's so rapidly and easily transmissible, most of the cases we're seeing in New York and actually nationally are Delta. And you can see Alpha, which was the UK variant, was actually dominant a few months ago. And you can see now it's only 1% of the cases. What I want to mention, and this is something that's really important, and as we think about Delta, Delta is much more contagious than Alpha, which was twice as contagious as the original strain. So as per the state DOH, there's been 1,000% increase in cases in the past 6 weeks. I mean, that is really something very troubling. And this is part of the reason why there's been particularly a push for those of us that take care of others in vulnerable settings, and those of us that are responsible for looking after those that are immunocompromised, that at least we make sure that we are not only protecting ourselves and our immediate family, but also protecting the community and those we take care of. So Delta, as I said, is highly contagious, much more than the original strain, and some data, and now it's kind of confirmed that Delta also may cause more severe severe infection than the previous strain, particularly in unvaccinated. So what is the biggest concern? The biggest concern is those that are unvaccinated. They remain the greatest concern. And as Chelsea mentioned, most of the cases we're seeing are in those that are unvaccinated. We're also seeing a rise in the number of cases in younger individuals and in children. And in the southern part of the country, there are ICUs that are pediatric ICUs that are full of young children. And certainly we don't want to spread this to those that we know cannot get vaccinated. So our children under the age of 12 are not yet eligible. So we have to protect them. And then we have the elderly community that may be vaccinated, but may not have an immune system as robust as a young person. And we have to protect them as well. So unvaccinated people are of greatest concern when it comes to Delta. And we also know now that when people are fully vaccinated, they can still carry the infection and transmit it to others. And we are seeing cases of breakthrough infection. And I'm going to talk about that in a minute. So those are kind of the important things to remember. So this is something that Chelsea alluded to already, that hospitalizations, hospitalization deaths have been rapidly increasing. And you can see right around early July, they start to skyrocket here, because that's when Delta really started to take a stronger foothold in our community. And you can, it's easy to understand if you think when you have 5 cases for it to double to 10 and then 20 and then 40. But once you get to numbers like 1,000 for it to double to 2,000, those happen much more rapidly, because now you have 1,000 people able to spread it to so many more. This dip that you see at the end is because of lag of data. We are seeing some plateauing and stabilization of hospitalizations as well as cases, but that doesn't mean that we're out of the woods by any stretch. We also know that the colder weather is coming. People go indoors, they tend to congregate. And we also know that there are other variants of concern that are being tracked by the CDC. Remember also, this is not a local or a state issue. It's not even a national issue, it's a global issue. So, as variants emerge in other parts of the globe, they will, spread all over if we don't, vaccinate people across the board. So that's something important to remember. So this map we already talked about, but again, it's pretty striking to see how much dark red we have on Staten Island. COVID positivity rate has been for quite a while been higher than the rest of the boroughs. And I will tell you that these dark reds seem to be spreading across the borough. It was initially only in 3 zip codes in the South Shore, 3 or 4 zip codes that we had these dark reds. Now you can see them moving to the North Shore zip codes. And we also see similarly hospitalization rates going up in multiple zip codes on Staten Island. I will tell you that we have an incident command team that consists of doctors and safety officers from both hospitals. We talk on a very regular basis, keep a close eye on the situation at the hospitals, as well as nursing homes and other settings in the community. And we have been fluctuating. One of the hospitals has as high as 60 or plus cases just a week ago. Now there are about 50 cases, and about a third of them are in the ICU. They are getting younger and younger. There were a number of pediatric cases in one of our hospitals, and we also have many individuals between the ages of 18 and 55, whereas previously we were seeing mostly people above 60, 65, 70, 75. So just want to mention that you know, our community is getting hit hard, and many of the people in the South Shore neighborhoods are not vaccinated, and those are the areas where we're seeing the highest caseloads. Okay, so I think Chelsea mentioned all of this already. We've vaccinated lots and lots of people, not just across the US, fully vaccinated 174 million, and total doses 370 million. New York itself, New York City, almost 5 million are vaccinated and 10 million doses administered. And this again is something that was covered already, just shows you a quick snapshot of the different vaccination rates, 1 dose and fully vaccinated of the boroughs, and Staten Island is somewhere in the middle. We have about 55% of, we're below the city average, but we're behind Manhattan and Queens, and sort of, you know, a little bit ahead of the Bronx and Brooklyn. But a lot of work still to be done, because 55% fully vaccinated is nearly not enough to achieve any kind of herd immunity. And then this is just showing you again in the form of a map the number of people on Staten Island and citywide that have at least 1 dose or fully vaccinated by zip code. And you can see here on the Staten Island map that there are many zip codes that are falling behind, and many of those have the ones that have high rates and high hospitalizations. Okay, so shifting gears a little, we're going to talk about vaccine breakthroughs. I'm sure everybody's hearing about vaccine breakthroughs. I just want to say that vaccine breakthrough is expected. Nobody ever said, and no matter whether we look at any vaccine ever created in the history of mankind, no vaccine is 100% effective. In fact, these vaccines have proven to be one of the safest, most effective vaccines we've ever developed. So if you think about the pediatric vaccines that are developed, they are in the tunes of 94, 93, 94, 95%, 96% effective, which means that still out of every 100 people, if they are 95% effective, 5 people are still going to get the disease. So the more people, the higher the infection rate in the community, the higher the people that we vaccinate, the more breakthrough infections that are going to happen, right? The important thing is that fully vaccinated people are less likely to get serious illness than those who are unvaccinated. And the symptoms, if they do develop, are going to be mild, and they're much less likely to be hospitalized or die. And CDC is still collecting data to understand the percentage of breakthrough. And I'm going to talk about a report that the health department put out recently. But the bottom line is that the vaccines protect you. And that's what's important. They protect you from getting severely ill. The odds are in your favor if you get vaccinated. I spoke to a group of young students today, and I asked them, why is it important to get vaccinated? And they were spot on. And they said, Well, because when you get the disease and you get the illness, you have no idea how severely it's going to affect you. You don't know if you're going to be hospitalized, how ill you're going to be. You don't know if it's going to affect you long term, and you have symptoms for months. With the vaccine, you know, once you take it, you're going to get a little soreness, a little fever, maybe some chills for a day or two, and then you're going to have your body's own immune system kick in and help protect. So that is absolutely right. You have no idea how severely you're going to get affected if you're not vaccinated. But if you are vaccinated, you know that it's going to prevent you. The odds that it's going to protect you are so much more. And it's going to significantly reduce the likelihood of hospitalization and death. And so the best way to slow down the spread and to prevent the infection by Delta and other variants is to get people vaccinated. But as I said, you can still get breakthrough, and in areas where there's high transmission or substantial, you have to protect yourself. As Chelsea mentioned, there are multiple layers of what you can do in our toolbox, and we have to put all of those to use. And then again, people that are immunocompromised cannot always build the same protection. So we have to protect them as well. So as I mentioned, the City Health Department had put out some data on the effectiveness, and they talked about the breakthrough cases. And the bottom line again is that if you're unvaccinated, you are 3.1 times more likely to get COVID than fully vaccinated, and unvaccinated are almost 10 times more likely to get hospitalized than those that are vaccinated. So without going into percentages and numbers, and there's a very small percentage of people that are fully vaccinated that end up with breakthrough and hospitalization. And just, I was saying this to the students as well, if you have 100 people, 5 out of 100, if you have 1 million now, it's 50,000, right? 5% would be 50,000 of 1 million. So it sounds like a lot, but that they're doing what they were expected to do and better. So last couple of things, and I know that we've talked a lot about all of this already. There's been some updated guidance for testing and for masks, and CDC put out a guidance, and then the city and state as well. You should, even if you're vaccinated, of course, if you're unvaccinated, get vaccinated and continue to do the core 4 plus regular testing. But for those that are fully vaccinated now, you should continue to wear masks in public transportation, congregate settings, schools, and healthcare, and then also in indoor setting now. They are recommending that you should continue to wear masks. And this is the New York City's safety requirement and policy. For city workers, they are requiring proof of vaccination or negative weekly test. And city launched a new app to show proof of vaccination. Chelsea talked about the Key to NYC Pass, which began on the 16th. And it is required for employees and customers that are engaged in indoor dining, fitness, and indoor entertainment and performance, all to be vaccinated. And if you want to go into an indoor restaurant or fitness, you have to show proof of vaccination. And then city also is outreaching to businesses to answer questions, and the enforcement for this will start on the 13th of September. So what's new and on the horizon? We know that FDA has fully approved the Pfizer vaccine. And I know Beth will talk about this. And some people were asking, why has it taken so long? Well, that's because they wanted to make sure that they didn't cut any corners, and they had enough data in phase 4, which is what we've been in currently. And so they wanted to have 6-month and 9-month data to show safety and effectiveness of the vaccine. And that's why they actually waited. And then the health department has authorized a 3rd vaccine dose for New Yorkers with compromised immune systems. And that was following CDC's recommendation. You heard that the boosters for everybody is still on the table. It's still being evaluated. And what's also new is that all healthcare workers in New York State, including staff at hospitals, long-term care facilities, nursing homes, adult care, and congregate settings will be required to be vaccinated by Monday, September 27th. And FDA is also reviewing the data for children under 12, and we hope to get that emergency use authorization for fairly shortly, perhaps before the end of the year. So I will stop there, and if there are no questions, I can hand it over to Beth, or we can just take questions at the end.
Okay, hi, everybody. My name is Beth Niven. I'm a Staten Islander also, so I really care about what happens in this borough. I'm kind of a tech dummy, so Shayla is going to be working my slides, and I'm going to just start going. So I've been giving talks at nursing homes for the past month or so, and everywhere I go, people have the same few questions. What is this vaccine? Where did it come from? What does it do to me? What does it do for me? So I'm going to try to answer some of these questions. I think, Shayla, we can go to slide 12. Here it is. So people want to know, how did this get started so fast? Most vaccines take years to get developed. This just took, it just came out of nowhere. It didn't come out of nowhere. It didn't get made from scratch. Scientists really built on things that have been in development for quite a long time from other vaccines and also from other coronavirus vaccines. And what happened here was really a great study in collaboration. Normally when vaccines are developed, they're developed what they call sequentially. You have the development, the testing, the production. Each step takes quite a while. Here, because of the money given to the manufacturers and the collaboration and cooperation, things were able to be done sequentially. So you have the development, the testing, the production being done at the same time. And many, many people got together to work on the storage, distribution, supplies, and other logistics. No corners were cut. It was built on a lot of scientific data that was present, and then developed due to just a terrific blend of collaboration, cooperation. People who normally don't talk to each other were reviewing data together, sharing things together. So this was a really a well-coordinated response to get this vaccine developed quickly. Next slide, please. So again, no corners were cut. There were no shortcuts taken. The FDA reviewed the data many, many times over. And again, as Ginny said, the clinical trials began sometime around September. So now we have almost a year's worth of data. And many people got together to review the data. Next slide, please. So as you know, originally, the vaccines got what they call the EUA, the Emergency Use Authorization. That is not a shortcut. In order to get that, you have to go through many, many steps showing both safety and efficacy, which the vaccine manufacturers were able to do. Last Monday, as you recall from the newspapers, Pfizer vaccine got full FDA approval. So all those people who said, I'm going to wait until it's fully approved, now's your chance. Pfizer was fully approved for people 16 and older. So we have 3 vaccines out there. Pfizer now fully approved for a certain age group. Moderna, which put in their request for FDA approval a little bit later than Pfizer, and is expected to get full FDA approval sometime in the next month or so. And Johnson & Johnson, which is going to apply very soon. They're just looking to get some more data on safety and efficacy. So you have 1 fully FDA approved vaccine and 2 that have the EUA, which is also an approval that's based on a lot of data for both vaccine safety and efficacy. Next slide, please. So people want to know, well, how do we know what's really happening with these vaccines? So it's really a pretty transparent method. When people get the vaccine and they have any kind of side effect, whatever that is, they or the provider can really report that to a public domain, a public website called VAERS, Vaccine Adverse Reporting System. Anybody can report anything that happens to them after the vaccine. Things happen to them that might be caused by the vaccine or might not. And people who don't want to go to VAERS can do this on a smartphone through this application called vSafe. When a health event is reported to VAERS, there are people that are looking at it. So if scientists who monitor this website see any commonality, they're going to be exploring the insides of it to see what is going on. So any of you could go on to VAERS and actually see what's being reported there. It's pretty simple to use. You could do your own reports if you want to look at something that happened, whatever side effect you want to look at. You can do that and actually look at the numbers. Again, the numbers on VAERS doesn't reflect things that happened because of the vaccine. It reflects things that people have reported that happened after the vaccine. The cause is something that scientists are looking at. And if scientists are looking at it, you can be sure that also journalists will be looking at it. And I'll talk about that a little bit later. So it's really pretty transparent method. And if anybody doubts me, just go on the CDC website called VAERS and see what's being reported and see what you can look at yourself. Next slide, please. So how do the vaccines work? This is two of these vaccines are kind of new. So that whole technology is kind of boggling people's minds. So first, what is the vaccine? So you all know that when your body experiences something foreign, be it a virus, a bacteria, or a parasite, your immune system starts going to a defense mode and starts producing antibodies to fight this foreign substance, whatever it is. So what a vaccine is a substance that mimics this foreign nature and gives your body a heads up. Because when you encounter something foreign, your body starts making antibodies, but that takes a little bit of time. What the vaccine does is it gives your body a prompt, a little boost to ramp up the immune response. Vaccines have been around for a very long time, and they've been really responsible for really a lot of success stories in terms of diseases. Next slide. So these are vaccines that have been around for diseases that have been around and sometimes are not. So smallpox, if you remember, was a scourge. I think that's the word. The world over, there was a huge vaccine campaign. And in New York City itself, there was a big campaign in 1947 when there was one case of smallpox. The city just really ramped up its vaccine distribution. And if anybody's interested, there are great pictures that show lines circling the Department of Health building at 125 Ward Street, waiting to get this vaccine. And whatever little blip there was in New York City in 1947 was obliterated. And as you can see, smallpox obliterated due to the vaccine. Polio, some of you are old enough to remember what polio did to people years ago. And again, those of you who are around my age, who remember getting polio tabs in school, polio is now sort of a non-issue. Tetanus, again, a lot of tetanus cases causing lockjaw. Tetanus, very, very low incidence these days. Measles, again, measles is a work in progress. Measles is definitely way down, but there's still pockets of areas where people are not getting vaccinated, where measles crops up. So again, vaccine production has been around for a long time, and it could really, you can see that vaccines themselves have been the cause of celebration in the eradication of many very serious illnesses. Next slide. So what's bothering people here is that there's a new kind of vaccine, one thing they haven't seen before. Many people are used to the flu vaccine. That's an inactivated virus. And again, when I give my talks about flu, people would say, oh, no, I don't want any kind of virus into my body. But actually, this inactivated vaccine that's in flu, it's almost dead. It can't replicate. It can't cause you any harm, but it does stimulate your immune response. The J&J vaccine is something a little bit similar to flu vaccine in that there is an introduction of another kind of vaccine, again, one that cannot cause you any harm, but that stimulates production of antibodies against COVID. So people are kind of familiar with that technology. We have an almost inactivated or a modified vaccine that enters your virus that enters your body to ramp up your immune response. This mRNA technology is something new, and it's so new that it sort of caused a lot of consternation in people, and they want to know, what is this thing? So this is nothing new. This mRNA technology has really been around since 1985, and it's been used in some cancer chemotherapies, and it's been used to look at, yes, I got a question, should I get my annual flu shot this month? Get it. You don't have to get it this month. You can get it. I get mine really early. Get it. Yes. No reason not to get the flu vaccine. I'm a big flu person. So go out there. CVS has got banners out there saying flu vaccine is out there. Go get it. Now back to COVID vaccine, mRNA. So mRNA, we all have mRNA and DNA in our bodies, and you know that these are molecules that instruct our body to make proteins that we really need in order to function. So what happened here is that we have next slide, I'll show you how it works. So mRNA, the scientists got together and they were able to sequence the coronavirus, and they found a little sequence that gave the instructions to make the spike protein. You all remember the coronavirus has a spike protein that allows the virus to go into and out of cells, and that's what makes the virus so efficient in causing illness. So there's an mRNA piece that gives instructions on how to make the spike protein. So your body gets this mRNA instructions, it makes the spike protein, and then it realizes, wait, this is not something that's in my body, this is foreign to me. And because it's foreign, your immune system starts making antibodies against that. The mRNA is a short-lived molecule. It's easily degradable. It leaves your body, does not get into your DNA, does not get into your cells. It lives in your body long enough to give you the instructions, and then it disintegrates. The spike protein is in your body, but then your body is making antibodies against that, and that too goes away. What's left in your body is the memory of how to make these antibodies against the spike protein, so that should you encounter COVID again in the future, your body will then ramp up into this, let's make these antibodies now mode. Instead of waiting for days or longer to get the antibodies made, your body is now going to make them much, much quicker, and those antibodies are going to focus on the coronavirus and get rid of it. And that's how this vaccine works. Next slide. And I think the next slide is a video which hopefully will show you how this is done graphically, if it works. Okay, it didn't work for me earlier, but if it doesn't work for you, you can get on a lot of websites, and just YouTube, I think, has a video. It's really very, very simple, incredibly brilliant technology that now will probably be used for other vaccines. It's really some kind of technology that is going to be like a magic formulation to hopefully make other vaccines that are going to be really, really useful. But in this case, again, very, very simple technology. Your body gets instructions to make the spike protein. Your body then makes antibodies against this foreign spike protein, and then your body keeps this memory of how to make these antibodies, and that's really the simple part of it. Next slide. So again, go on YouTube and you'll see. So people want to know what is in this vaccine, and again, when I go out to give these talks, you have no idea what things I hear are in the vaccine. So let me tell you what's really in the vaccine. So you have this mRNA, it's a very, very little protein. It's very fragile, so it needs a little bit of fatty coating to make it last in your body long enough to give the instructions. And what the virus has is the mRNA, the protein, the fat, salts, sugars, and a little bit of acid to keep the integrity of the vaccine. What it does not have are all these other things. There are no microchips. I don't know why Bill Gates would want to monitor me forever and ever. There are no microchips. There are no magnets. I see on Facebook all these claims that if you put a magnet on somebody's forehead, after they've gotten the vaccine, it'll stick. Try it on yourselves. It does not stick. I've tried it on myself. There is no fetal tissue, blood products, antibiotics. The virus that causes COVID, definitely not. If you go on the FDA website for all of these vaccines, it gives you an exact ingredient list. So you will not see these things. These things that you see here are things that are being disseminated on Facebook and other social media. We call them disinformation, but you're not going to be seeing these things in the vaccine. What you're going to be seeing are some very, very simple ingredients that we all know, that we all encounter in other vaccines, lipids, salt, sugars, and some acid, some kind of acid. So again, nothing that really harms you, but I'm going to talk about side effects later. Next slide, please. So people want to know, I'm going to talk about what the vaccine does to me and what does the vaccine do for me. So let me just talk about what does the vaccine do for me. So we discussed that each of these vaccines, Pfizer, Moderna, Johnson & Johnson, has started clinical trials for Pfizer in September of 2021, or 2020, so almost a year ago. And each slide had about 30 to 40,000 people. So in the clinical trials, there are over 100,000 people in the trials. Since then, as you saw, we've had 370 million doses administered in the US alone and 10 million in New York City. And we saw some vaccine breakthroughs, that's true. But what you're seeing is the vaccine, again, as Ginny said, the vaccine was never developed to prevent you from getting COVID at all. So you could still get the vaccine and get COVID in your nose and test positive. You could still get the vaccine and get some symptoms. But what the vaccine does really, really well, despite what people say about winning immunity, it really, really protects you for the things that really matter, and that is hospitalizations and deaths. For me, if I could just share my personal story, my biggest fear in life is not death, it's intubation. I'm very, very claustrophobic. I can't even wear goggles when I'm swimming. And to me, the idea of the vaccine really preventing the possible hospitalizations, intubation, was really the kicker for me to run and try to get a vaccine no matter where. So again, the vaccine efficacy is really quite strong now for where it really matters, which is hospitalizations and deaths. And again, all three vaccines protect really well against Delta as well. You see vaccine breakthroughs, but again, just to reiterate the numbers, but 97 to 98% of hospitalization deaths currently, even in the landscape of Delta, are occurring among the unvaccinated. So you do have 2% or so that are among the vaccinated. Again, some of these are older people with other comorbid conditions. But again, it's we hear about people who are older, who have comorbid conditions, going to the hospital, being fully vaccinated, and then leaving the hospital, something that would not have occurred pre-vaccine. So again, just to reiterate, the vaccine works really, really well, even now with Delta, in protecting people against what really counts, which is hospitalizations and death. Next slide, please. And again, we discussed this. Next slide. Ginny already talked about this again, about the booster. Next slide, please. Who can get vaccinated? So again, now the field is open. Anybody in the US who is 12 and older can get the Pfizer vaccine. COVID vaccination is free and it is very accessible. When I got my vaccine in January, I spent night after night at midnight going on the computer like this, trying to refresh to try to get a vaccine site in those days. If you remember, in January, February, you had to wait online, you had to wait forever to get a vaccine. Those days are over. Anybody can get a vaccine, it's free. It is being given out in so many different places. I live right near the Greenbelt, and now that Greenbelt, the Brielle gym area is giving out the vaccine. You can walk in and walk out in a matter of, after the medical monitoring, you can walk in and out in a very, very short time. So now there's no issue of access, there's no issue of cost. You don't have to bring documentation. Privacy is protected. It is so much easier now than when I got it in January and February. That really, the access issue is really a non-issue. Next slide, please. People want to know, can I get the vaccine? I have X, Y, and Z. So the answer is, if you have any issue, a question, you can speak to your provider, but most people with medical conditions can and should get vaccinated, because we saw during COVID that people with medical conditions seem to fare worse than people without those underlying conditions. So again, for some people, I always tell people, again, with the flu vaccine, if you have an underlying condition, run, don't walk to get the vaccine, because this vaccine is really for you. So again, in the clinical trials, there were people with underlying conditions. They got the vaccine, and now after almost a year of looking at, monitoring them, they have not had adverse reactions. The vaccine was shown to be safe and effective for many, many kinds of underlying conditions. And again, all you've got to do if you have a doubt is go speak to your doctor. Next slide, please. So pregnancy, as it turns out that in the clinical trials, there were not people who were pregnant. So initially, we didn't really have data about pregnancy in those clinical trials. But since then, there are dozens of people who were in the clinical trials who were not pregnant before, who did become pregnant, and again, reported no adverse reactions with having gotten vaccinated. There are about 35,000 people who are pregnant who self-reported and again attested to the safety and efficacy of COVID vaccine. And we saw that during the height of COVID, people who were pregnant and had COVID seemed to fare much worse than people in the same demographic who were not pregnant. So we know that our pregnancy seems to be a high-risk condition for pregnancy that can really lead to some tragic outcomes. And that's why I think all of the OBGYN so groups and CDC really advocate now for people who are pregnant to get the COVID vaccine. And again, as part of the disinformation that's out there, there were some issues about fertility problems. There was some disinformation out there that the mRNA vaccine that gives you instructions to make the spike protein was also giving instructions to make antibodies against a protein that was in the placenta, saying that those two proteins were identical, but your body knows what is similar to, your body knows what is what. Your body is being given information to make antibodies against the spike protein. It's not going to make antibodies against something else. So again, I know people have heard this disinformation about the placental protein. It's not an issue. It's part of the, I don't want to say whatever it's called, the fake news, the disinformation that's out there, but not true. So again, right now we have a lot of people's experiences with pregnancy and the vaccine, and it is shown to be safe and effective. And again, just want to reiterate that pregnancy is a high-risk condition for COVID and can and has presented some adverse reactions for people who are pregnant with COVID. Next slide, please. So people want to know, if I had COVID already, I already have antibodies, so why bother? This is a very common question. So a couple of things. One is that we know that people can get COVID again. We're doing a study on reinfection, so that's one thing. People don't know if they've had COVID, what their level of antibodies is. It depends on when you have COVID, did you have a mild case and no cases, but it's been shown again and again that even if you've had COVID, vaccination boosts your immune response. So you really get a really good level of protection, even if you have had COVID before. So again, having COVID before, I don't know where your antibody levels are. You don't know what protection you already have. Getting the vaccine really assures you that you have a certain level of protection. And again, vaccine is really a safe way to make sure that you have this boost, this ramping up of the immune response. So if you currently have COVID, you need to wait. But if you don't have COVID, you can definitely get the vaccine safely and effectively. Next slide, please. So people want to know, if I have allergies, should I really get the vaccine? And the question is, if most people have allergies to things like dust mites, peanuts, those people get the vaccine. But again, if you have any doubt, speak to your provider. If you remember in the early days of a COVID vaccine, there were some issues with anaphylactic reactions. That's a very severe allergic reaction. There were some people who got anaphylaxis after getting the COVID vaccine. Those people were given epinephrine and EpiPen. And again, this is why you need to be monitored for 15 minutes after you get the vaccine. If there's an anaphylactic reaction, it's going to happen very soon after getting the vaccine. Rare, occurred very, very rare. A couple of reactions per million doses. The people who got anaphylaxis were treated pretty quickly. They did very well. And when asked after the first dose, they got the anaphylactic. When asked whether they would get the anaphylactic reactions, should ask their doctors. And again, if in doubt, ask your provider. Next. Next slide, please. So again, we talked about why get vaccinated is to prevent hospitalizations and deaths. We've covered that. Next slide, please. Where can I get vaccinated? We talked about this also. This is the website that you should really go to, nyc.gov/vaccine finder. There's also phone numbers. These slides will be shared, so everybody can get this slide that shows exactly where to get the vaccine. But again, if you walk by CVS or Walgreens, you will be sure to see the sign that says vaccine given here. Next slide, please. Same thing. Next slide. You just need to bring proof of age. That's really just about it. People want to know, I mean, the vaccine distributors want to know that you're not under 12. For kids under 12, you do need parent guardian consent, and people 12 to 15 have to be accompanied by a parent guardian. So, but for everybody else, you could just walk in. You don't need any ID. I know I went with somebody this weekend to the Greenbelt Center, walked in, asked to get the vaccine, no proof of anything, no proof of insurance. I mean, he looked to be over 12, so they didn't need to have proof of age, but really no ID required. Next slide, please. So for Pfizer, Moderna, you need to get 2 doses. And you should get it the same place you got the first dose. If you can't, you can get vaccinated elsewhere. The second dose should be the same as your first dose. If you've gotten Pfizer for the first dose, get Pfizer for the second dose, same for Moderna. And there's a schedule, you need to wait 3 weeks after Pfizer and 4 weeks after Moderna, or as soon as possible. If more time has gone by, that's okay also. And it's good to bring your proof of vaccine card with you when you go for your second shot. If you don't, that's okay too. That's fine. That's what happened this time. Okay, next slide, please. Okay, so people want to know, another big question is, what does the vaccine do to me? I know what it does for me. There's a lot of great benefits, but I'm afraid of what it's going to do to me. So here's the answer. Again, the answer is really not much. And I know because I live with a person who just got the vaccine this weekend, so I can tell you what happened to him. But basically, it's a shot. There's no nasal spray for COVID vaccine. So it might hurt you for a little bit. It might hurt you for a little bit longer. You might have some limited mobility for a little bit. You can definitely take Tylenol after the shot. Don't take it after. Don't take it before, but take it after. You could take Tylenol. You could take Advil, which the person I live with did. And what's going to happen afterwards varies from person to person. But after the first or after the second shot, you might feel fatigued, might have a fever, you might have chills. After the second shot, slept for a day after. That's about all I felt. I did feel some chills. And what this is really what is thought to be a manifestation of your body ramping up its immune response. You get the shot. I explained to you what happened, that you have this mRNA with the spike protein being made, your body going to antibody production. What you're seeing in these chills, fever, fatigue could be a manifestation of a ramping up of the immune response. So again, these last for a day or two. Tylenol really, really helps. I can attest to that. And I can attest to the fact that the person that I live with that just got the vaccine is kind of a whiner. He did not whine after the second day. So he got the vaccine, he's forgotten all about it, and he's on his way to protection. So again, it's a short-lived side effect, 1 to 2 days, that could really be alleviated by Tylenol or Advil. If your side effects persist, if you have any issue, call your provider. Next slide, please. And again, that's it. If you have any issue with side effects, call 311 or your provider. Next slide, please. So again, I spoke about allergic reactions. They're very rare. And that's why you want to stay in the medical monitoring area for 15 minutes, because if anything like an anaphylactic reaction occurs, it's going to occur very, very quickly after the vaccine. But again, very, very rare. If you go home and you get this severe allergic reaction, call 911 or go to the nearest hospital. Next slide, please. So again, let me just go back to VAERS for a minute. I told you VAERS is a transparent website that scientists are monitoring. They're monitoring, looking for any common adverse reactions that may be attributable to the vaccine. People put all kinds of reactions in there that may be totally not able to be attributed to the vaccine. So since we've been monitoring VAERS, a few things have come up. And again, these things are rare. So there have been some blood clots following the J&J vaccine. This occurred in women under 50. And when this occurred, there was a pause. They stopped giving out the J&J vaccine for a while they discussed what this rare side effect means. And then they felt that they wanted to restart the J&J vaccine because the scientists felt that the benefits far, far outweighed the risks. So now we know that clotting issues occur much, much more frequently with COVID infection itself than with COVID vaccine. So if you have a fear of getting blood clots, then you should really fear getting COVID infection. Again, I don't know what the exact ratio is, but it's much, much higher risk of getting blood clots after COVID infection itself than after COVID vaccine. There was also some paralysis, Guillain-Barré syndrome. There's some paralysis that is usually short-lived. Some people may have permanent damage. Whether there is a cause between COVID vaccine and Guillain-Barré is not clear yet. Again, Guillain-Barré is something that you get spontaneously at the rate of about 1 per million. You can get Guillain-Barré after a cold, after a flu. So getting it after vaccine, it's not clear whether there's a causal thing, because again, people can get Guillain-Barré spontaneously at the rate of 1 per million. And then heart inflammation following Pfizer Moderna vaccine. There's been some issues of myocarditis as a heart inflammation, especially in young people. And again, these people, for the most part, were treated and did well. And again, myocarditis and some heart issues also occur with COVID infection, again, at a higher rate than they do with COVID vaccines. So again, these things were all investigated, and it just shows you that the VAERS system does work, because these things were picked up when people reported them. So again, just to show you that the side effect issue is pretty transparent. And CDC and other experts will continue to monitor the VAERS website to see if there's anything else that seems to be in common that might be attributed to the vaccine. But so far, the side effects that have been seen have been very, very rare. And again, the benefits far outweigh the rare side effects that have occurred. Next slide, please. So again, I think we talked about this, that people ask, why did I bother getting the vaccine if I still have to wear a mask? It's a really good question. And the answer is, part of it is Delta, is that Delta is so much more transmissible that people who have not gotten COVID yet stand a good chance now that they could get COVID, depending on where they are and what the situation is. So that's why masks are still being recommended indoors. I live in Staten Island, because I'm a little bit wary of the lack of vaccination in some parts of Staten Island. I wear my mask indoors all the time. I remember Costco just a few weeks ago said masks are recommended. I think now I go into Costco, most people are wearing masks. And again, we recommend wearing a mask in indoor public places. And if you have a condition or take medication that weakens your immune response, you may not be fully vaccinated, fully protected, even if you're vaccinated. So really consider wearing a mask in a lot of settings. So again, unfortunately, masks are still recommended for many. I mean, I'm fully vaccinated. I still wear a mask. I know that Delta is out there. It may go away at some point, but it's not going away right now. And I know that Delta is so much more transmissible that I really want to protect myself. I have my grandkids with me right now. I want to protect them because they cannot get the vaccine. So again, getting the vaccine affords you protection, affords those around you protection, because you're less likely, not totally, but less likely to infect others. So again, for the sake of the people around me, I choose to get vaccinated and I choose to wear a mask. And again, I'm thinking that COVID is not going away. There are people when I give my talks who said, but we thought the vaccine was going to make it all disappear. Unfortunately, it has not. For a lot of reasons, again, as Ginny pointed out, that these variants occur, the more COVID virus out there that's replicating, the more chance you have for mutations to occur leading to these variants. So again, because we don't know if Delta is going to be going anytime soon, if after Delta, there's going to be another variant that's going to be as bad, less bad, or worse, nobody knows. I mean, there's scientists who've been working with coronavirus for years and years who don't know these answers because this is all really new. So there are a lot of unknowns. So there are a lot of unknowns, but there are also a lot of knowns. And the knowns are the COVID vaccine gives you really, really great protection. COVID infection could be really, really not good for many people. Many young people who are otherwise healthy got COVID infection and didn't do that great. So we have some knowns. Fortunately, we also have unknowns, but you have to weigh the knowns with the unknowns and the risk with the benefits. And I think all that sort of points out to the fact that the vaccine is really beneficial for a lot of people where it really matters. Next slide, please. So again, when I give these talks, people just keep talking about the stress they feel. It's all COVID all the time. I turn on the news, it's all COVID, COVID this, vaccine that, and I know it's really stressful. So there are things you could do. And again, you're going to get these slides, so you have access to this. You can have access to a 24/7 counselor. If you call these numbers 888 NYC Well, totally confidential. It's not going to go into any record that you've had therapy, nothing like that. You can call that. You can call a counselor who will talk you through the anxiety you're feeling. Believe me, I have super anxiety about many things, and COVID is one of those things. I haven't seen my grandkids in a long time. Now they're here, still a lot of anxiety persists. So there's the New York Project Hope. There's a lot of emotional support out there. Do not be afraid to reach out to somebody. Nobody's prepared for all the stress that this has caused us. And it's not going away. So the stress is not going away. So we really urge you, this is free, this is confidential, this is really accessible. So use it, take advantage, it's there for you. Next slide, please. And I think that's it. I know it's really late in the day, so if you have any questions, we're happy to take them. You could also email the questions to us and we'll get them from Chris or from Ginny. If you have any things that I haven't covered that are really bothering you, and I'm sure there are things, please let us know. And we're here to try to walk you through the ins and outs of COVID vaccine. It's really a lot of information to process in one afternoon, let alone actually in a lifetime. But just whatever is bothering you, whatever is acting as a barrier to getting the vaccine, we'd really like to know so we can help you. And that's basically it.
Beth, thank you so much. This is Jean. And I think we want to leave time for questions. We also, I think, Chris, correct me if I'm wrong, but we also have a couple of people who have testimonials that we want to make sure we have time to share. Before we take questions, I think we maybe have a couple of minutes, but Chris, let me know if you want to move on and then we can take questions at the end. Tell me what you think is best.
Yes, hi, it's Chris again. I'd like to introduce Lenice Wiggins from Person-Centered Care Services. She's a transitional life skills coach, and she'd like to just share her personal story with the group. Lenice?
Hello, everybody. Thank you, Chris, and thank you for that wonderful presentation. That basically was something that everybody needs to hear. So if I get a copy of this recording, I'm sharing it because I know a lot of people who have these doubts and they're more worried about the vaccine than they should be worried about getting COVID. And that's one of the reasons why I finally, I decided that I was going to go out myself and get my vaccine. My mom is in her 70s and she was coming to visit New York. She lived in Florida. She lives in Florida, and I haven't seen my mom in 2 years because of COVID. So she came and she visited, and she had gotten fully vaccinated. And I thought about it and I was like, wait a minute. She went through and she's in her 70s and she got her vaccine, and, you know, it's up to me. I need to go do the same. And I went and got vaccinated because I knew I was going to spend a lot of time with my mom, and I didn't want to be the one to, you know, possibly get her sick. And then I thought about the rest of my family and friends, and then the community in which I work. People, immune systems are compromised. And I felt like I had to do my duty to be vaccinated so that I couldn't pass it to someone, possibly pass it to someone to cause their illness. And I don't want to see anybody get sick. I have family members right now that are COVID and that have COVID, and they're doing pretty well. I'm making sure that they stay in the house because, oh, I got to do laundry. And no, you got to stay home. You just stay home. You know, the laundry could wait. You go out, you might infect somebody and make them sicker than you are, because a lot of people think, oh, well, I only have a stuffy nose, or, you know, I'm not feeling anything. I don't need to go to the hospital. Yeah, you are. So I hope that everybody could just take the time and read the information, because it's out there, and stop listening to the naysayers or people just making up stories to
Lanice,
scare people.
Lanice, you're breaking up a little bit. If you could turn off your video.
You should not be scared. I grew up, we got vaccines when we were born. Okay. What I was saying was we were all vaccinated when we were born. We knew nothing about it. Am I still breaking up? Yeah, I must be.
No, you're good. You're good. We could hear you.
Okay. Yeah, so we were all vaccinated at young ages. We didn't know what it was. Our parents really didn't know what it was, but we had to have it to go to school. This should not be any different from that. This should not be any different. And again, I got the vaccine. I had a little, after the second shot, I had a little pain in my arm. I was sleepy. I slept for a full day. The next day, I was my old self again, and I moved on, and, you know, and that's it. And then luckily, because I went out and got it, my husband went and got his. And then my son, who's 20, and he thinks that, you know, he's invincible and he can't get sick because he's young and his immune system is strong. He went out and got his too. Yeah. So I just hope, I mean, that's the only way we're going to get this thing under control.
Thank you so much, Lanice, for sharing. Jean, I guess we'll open it up to questions.
Yeah, I think that'd be great. Yeah, we're happy to take questions if there's no further testimonial. I do just want to say a very heartfelt thank you to this group for all of your amazing hard work over the past year and a half. I actually recognize a lot of the names on the call. I know I've worked with a lot of you or your coworkers through our case-based outreach and response since last spring. And I know how difficult it's been to do this work in the face of so many challenges and this constantly evolving epidemic and response landscape. Also how incredibly dedicated this particular community of staff and administrators has been in terms of the care and commitment you've continued to provide to your residents and your clients and your coworkers and your communities and your families. I think that was evidenced just now in that amazing testimonial and in the folks who pulled this call together. Ginny mentioned this briefly, but I just want to mention again, I think Beth mentioned this too. Our team at the health department was created specifically to support OPWDD and other residential congregate settings. This includes not only case and contact investigation, but also technical assistance, resource coordination. We now have the ability to come on site to do testing and vaccination. And so in the slides, and I'll also put this in the chat, if you are interested in scheduling on-site vaccination for your facility, let us know and we can come out with a team that can do both testing and vaccination. But want to make sure we have an opportunity to answer any questions that you have for Ginny, for Beth, for myself about the data, about vaccines, anything we can do, and strongly encourage you to reach out to us separately if there's anything we didn't cover or if there's anything else you need help with.
Thank you, Jean, for those kind words. I think Doreen Smith has a question. Doreen, if you want to come off mute.
Yes, I have a question. I'm fine. Thank you, Chris. I'm very fortunate that you let us get the shots at PCCS. I had to go for a mammogram, and there was rumors going around, and it was also on Facebook, in the newspaper, that women who did get the COVID vaccines, they were finding out that they were getting lumps, and these women were getting scared that it might be cancer. How true is that?
I could take that question. So Doreen, that is accurate. Women were getting lumps, but I want to explain it to you. So if they were getting lumps, it's a good thing they were getting lumps, because the way the vaccine works is it works by boosting your immune system, and your immune system lives in your lymph nodes. And those, the fact that their lymph nodes were getting enlarged was a sign that their body's immune system was ramping up and responding to what, and doing what we wanted to do. So early on, we did start to see a few, and not everybody had these large, lymph nodes in their axillary region, but we did see that. And we were recommending, if you took the vaccine, wait for a few weeks before you got your mammogram. So so it was not a cancer related lump. It was just a known sort of effect of the vaccine, which we learned, as we gave out more and more doses, we learned that this is a normal thing that was happening.
That's good news. For me, being a breast cancer survivor, I'm glad to hear that that was normal, because I was a little nervous going for my mammograms, and I was smart and I waited. But I'm glad to know that that is a good thing. So I'm glad to hear that.
Yes.
Are there any other questions? Feel free to come off mute and ask your question. All right. All right, Jean wrote in the chat for more information about on-site testing and vaccination in residential congregate settings. She's gonna, I'm assuming she's putting the
I
link.
am. I pressed return and didn't realize it was sending. Yes, I will send it right now.
And I see
Chris,
Kayla
sorry.
wrote in the chat, it's sort of referring to what Doreen talked about. Something similar happened to her after her first dose. She felt soreness in the area, but she knew that she was fine. Thank you, Kayla, for sharing that. And Jean just dropped the link in the chat.
Chris, I just wanted to add something I did not cover, was that we do have the ability for those that test positive and that have some sort of underlying risk factor, either that they're older in age or they have underlying chronic illness. There's the option of taking monoclonal antibodies to help boost your immune system. So whether you're vaccinated or not vaccinated, if you test positive and you have an underlying condition, or if you just age as an underlying condition, you could get in our community. There's 3 sites that offer it out. So I just wanted to let everybody know that that's a resource that's out there for everybody. And I'm happy to share the locations of the 3 sites.
Great, thank you, Ginny. Kayla has a question. Is the booster different than the initial doses?
It's the same vaccine. It's not different. And that's why we're asking that if you had Pfizer the first time, you get the booster with the Pfizer, or Moderna have the booster. But just to be clear, the booster has not yet been approved. What's been approved is the 3rd dose. And the reason we're differentiating between the 3rd dose and the booster is because the people that it's been approved for, the 3rd dose, are those that are immune compromised, that more than likely did not have the adequate response with the first 2 doses. So it's a third dose to get them to a level that would be, at where everybody else is. The booster is something that would be for us, the general public, and that's still is under evaluation by FDA and the advisory committee for independent practitioners. So that's still being evaluated. CDC is recommending it, but it hasn't been approved yet.
So I just wanted to ask like clarification because, so I know someone who was fully vaccinated and, but this person has lymphoma, and they were worried that because of the lymphoma that she wouldn't have an adequate response to an adequate amount of antibodies or whatever. And so she got an antibody test, and it did confirm that she does not have immunity despite the 2 vaccines. So they were saying, they don't know if getting the booster would help at this point because there is quote unquote nothing to boost. Does that make sense?
Based on underlying conditions, I believe that this person would qualify. Again, if there's, questions about whether or not you are eligible, I think the best thing to do is have a direct conversation with your healthcare provider to see if you, as an individual, based on your underlying condition, qualify or not. And then the whole purpose of doing the third dose is exactly what you said, that these people did not mount an immune response adequate with the first 2, but based on studies done and that are being actively done and done also in Israel and other countries, they found that the third dose did boost up the immunity for those people that didn't have the response with the first 2 doses, those that were immune compromised.
Thank you.
Okay, it doesn't look like there's any other questions. Any closing remarks, Dr. Mantello?
One closing remark, and I think this is important, particularly with Delta. We talked enough about how contagious and easily transmissible and et cetera, et cetera. I want to say that we have a lot of data now on, Beth covered the VAERS and the VSafe, and a lot of data to show that they're safe and effective in pregnancy. But I want to say that pregnancy in itself is a immune compromised condition where your body's immune system is suppressed. So pregnant women are more likely to catch it. We already said Delta is more contagious. It also can cause more severe illness in those that are pregnant, and particularly important to think about, your babies, because an infant has no immune system. But we found that when pregnant moms take the vaccine, the immunity and the antibodies do get transmitted to their babies and protect the baby. So that's important to sort of just point out. No, the only parting words I would have is that don't hesitate to ask. If you have any questions, please reach out to Chris or any of us, and we're always happy to provide the answer. And if we don't have the answer, we'll find someone who does. Remember also that things have been evolving very quickly with this virus and with the situation. And some of the reasons that you hear, this is okay today, but not okay tomorrow, or this, that's because they're rapidly changing, and we're learning new information almost on a daily basis, about the virus. And so, I just want everybody to understand that, I do get it, that it's hard to trust something when you feel like it might change tomorrow, but unfortunately, this is a novel coronavirus. We've never seen this strain before. And so we are, obviously trying to adapt and learn as quickly as we can, but this virus has tricked us at every step. And every time we think we've sort of over the hill or the hump, so to speak, there's a new curveball. So I think we just have to be vigilant. We need to continue to do what we know works, such as masking and vaccinations, and protect ourselves and protect each other. So.
Thank you, Dr. Mantell. And I just wanted to thank you and our partners at the New York City Department of Health and Mental Health. I mean, we're very fortunate to have this relationship with all of you. You're subject matter experts on this, researching from a medical perspective, and just doing what you do for the sake of our community so that we can all be safe. And this vaccine, as far as I'm concerned, is a form of self-defense. It's very, very important that we learn more about it. For those of us who are vaccinated, let's continue to, practice the core four, like Dr. Mantello said, keep wearing masks. And for those of you who aren't, I hope this information was helpful, and I hope that you continue to ask questions and hopefully, take the next step and get vaccinated. Jean, any parting words from your end?
No, just to say thank you again so much to everybody involved, and to really, like I said before, just reach out if you have questions, reach out if you need support. That is what we're here for. Yeah, really, really just appreciate so much the work that everybody on this call has been doing. Very,
Yes.
very incredible. It's really incredible. It's goosebumpy. It's incredible.
Thank you.
Incredible community.
Thank you. And to all my colleagues and friends, I'm very proud to work alongside of you. Thanks again for being on the call, and we'll send out more information and the link to the recording so you can review it at a later time. Thank you.
Oh,
Everybody.
let me
Oh,
throw in
Jean.
one more thing. Yeah, I'm going to leave one more thing in the chat, which hopefully will be shared with folks, which is there are so many vaccine related resources and other COVID related resources. So I think we shared a lot of data. There are also a lot of fact sheets, and we have different resources that are geared to different populations. We have one in particular for the DD population. So I'll just share a link and then reach out if there's anything else we can do.
And we
There was
have
a request for the Regeneron, so we can perhaps include the DOH latest, community facing, and I can put the link there if you like.
Okay, great. And those of you who registered, we have your names through the registration. But feel free to leave your name in the chat if you'd like. Jean, if you could send some of the links